Imagine you're walking into your healthcare provider's office and you're trusting them with your health, but you find out that they don't have the authority to prescribe you the medications that you need simply because they're a nurse practitioner and not a doctor. Does that make sense at all? Well, in today's healthcare, one of the most pressing issues is the accessibility and quality of care available to patients. With the rising healthcare demands, particularly in underserved communities, advanced practice nurses or APNs have become an essential part of the solution. However, despite their extensive education and training, many APNs still face restrictions when it comes to prescribing medications. The question we must ask today is if APNs are highly trained healthcare professionals that are capable of diagnosing and treating patients, why are they still limited to their ability to prescribe medications independently? Today, I'm going to be discussing why APNs deserve this authority by highlighting their clinical expertise, their role in expanding healthcare access, and their ability to lower healthcare costs, and the ways in which they can improve patient outcomes through continuity of care. First and foremost, I want to go ahead and highlight their clinical expertise and education. APNs are highly educated professionals with rigorous training that prepares them to diagnose illnesses, develop treatment plans, and manage patient care. To become an APN, one must obtain a master's or doctoral degree in nursing, complete thousands of hours of clinicals, and undergo specialized training in areas such as pediatrics, geriatrics, and family medicine. This can be found in the American Association of Nurse Practitioners. You can go ahead and look on their website. With that being said, their education equips them with the necessary knowledge to prescribe medications safely and effectively. APNs are trained to assess patients, interpret their lab results, and select appropriate treatments based on the individual's needs. Many of them work in specialized fields, which deepens their expertise in managing chronic diseases and complex conditions. When we are restricting their ability to prescribe, it undermines their extensive training and limits the care that they can provide. If APNs are trusted to diagnose and treat patients, then they should also be trusted to prescribe the necessary medications to support their care plans. Beyond their qualifications, APNs play a crucial role in expanding healthcare access, particularly in underserved areas where physician shortages are a growing concern. Many patients in these areas face long wait times or must travel significant distances to see a physician. APNs can bridge this gap if they are given the full authority to do so. In many rural communities, APNs serve as a primary healthcare provider. However, restrictive prescribing law forces patients to wait for a physician's approval before receiving necessary medications, which causes delays in their treatment and worsens health outcomes. By granting APNs full prescriptive authority, we can reduce these delays, improve timely access to care, and ensure that the patients receive the treatments they need without unnecessary barriers. Another significant benefit of granting APNs prescriptive authority is the potential to lower healthcare costs. Studies show that APNs provide high-quality care at low costs than physicians, especially when it comes to managing chronic illnesses and preventative care. APNs often have shorter wait times, meaning patients can receive more care efficiently and reduce the number of emergency room visits and hospital admissions due to untreated conditions. Additionally, when APNs have full prescriptive authority, patients can avoid unnecessary follow-up visits with their doctors simply to obtain a prescription, which can save both money and time. Empowering APNs to prescribe medications independently can lead to a more cost-effective and efficient healthcare system overall. Continuity of care is vital for patients, particularly in those with chronic conditions that require ongoing treatment. APNs often build long-term relationships with their patients, gaining a deeper understanding of their medical history, lifestyle, and specific health needs. However, when APNs are unable to prescribe medications independently, they must refer patients to doctors for prescriptions, which can disrupt their continuity of care and causing unnecessary delays. With full prescriptive authority, APNs can provide seamless care by adjusting medications as needed and responding to changes in a patient's condition without external barriers. This consistency strengthens patient trust, improves adherence to treatment plans, and ultimately leads to a better healthcare outcome. When APNs are empowered to provide comprehensive care without restrictions, patients can benefit from a more personalized and effective healthcare experience. In conclusion, granting APNs full prescriptive authority is not only a logical step, but a necessary one for the future of healthcare. These highly trained professionals possess the expertise needed to prescribe medications safely. They're essential in expanding access to care, they contribute to the cost savings in the healthcare system, and they enhance continuity of care for their patients. The current restrictions on APNs, full prescriptive authority, create unnecessary barriers that ultimately harm patients. By recognizing the full capabilities of APNs and allowing them to practice to their full extent of their training, we can build a stronger, more accessible, and more efficient healthcare system. The time for change is now, so let's trust APNs to do what they are trained to do and grant them the authority they need to provide the best possible care for their patients. And these are just a list of the references that I use for this slideshow. I hope you guys enjoyed, and thank you so much.